Hi, I'm Brittany Butler, and I chose to do my journal article review on fear processing and social networking in the absence of a functional amygdala. Urbach-Wiethe disease is a rare, recessively inherited disease that affects a person's skin and brain. What the disease does to the brain is that it calcifies both sides of the amygdala, causing a person to feel no fear. Um, and we know that fear is controlled by the amygdala, as well as anger and social bonds. This article looks at the compensation for amygdala lesions. This study examined two twin sisters, patients 1 and 2, as well as 15 healthy women participants as the control group. There was two hypotheses in this study. One being, did patient 1 have less amygdala damage than her sister, patient 2, or did the functional compensation based on the adaptive reorganization help patient 1 be less fearful than her sister? To further explore functional compensation, researchers performed a series of tasks on the participants. The first task was a behavioral facial emotion task where the participants were shown happy faces, angry faces, sad faces, and things like that. The second task was a functional MRI that was given to test the researchers' predictions that following the preserved fear recognition would be an increased activity in the regions that help mediate that adaptive reorganization of information. The third task was to test for emotional regulation of the acoustic startle reflex. And the last task that was given was an SNI test, which is a social network index test. And it is concerned with who do you talk to on a regular basis, who do you see on a regular basis, like your inner circle, like your family, your friends, coworkers, and things like that. The findings from this article was that patient 1 displayed a more preserved fear recognition. He also had a more intact acoustic startle reflex and a larger social network. And so they concluded that the premotor face area, along with the inferior parietal lobe, is implicated in the mirroring neuron network system. And they believe that this mirroring neuron network system has something to do with that adaptive compensation of the amygdala.